Hello everyone, welcome at Sudhir. I coach a channel for emerging and budding ophthalmologists, and this is the platform dedicated for the ophthalmologists, those who are still learning cataract surgery. Today I am sharing an interesting case involving a young patient with the posterior polar cataract. As many of you are aware, posterior polar cataracts are often associated with weak and or dehiscent posterior capsule, and this makes the cataract surgery particularly tricky as the risk of posterior capsule rent is significantly higher and sometimes VR support might be required. So that is why before taking up any polar cataracts, we always ensure that VR surgeon is informed and available, and planning ahead is essential to avoid intraoperative surprises. In this particular case, since the patient was young and the cataract was soft and almost no nucleus, so lens aspiration was quite straightforward. However, there was a plaque on the posterior capsule which required careful polishing. So this is the time where you have to be very cautious, and often we can leave the plaque if it is quite adherent with the posterior capsule, but here it was lifted, and I thought that we can remove it easily with the fluid. During the polishing step, a small posterior capsular rent developed. This can be especially challenging when you are implanting a toric intraocular lens because any extension of the rent can affect the IOL centration and stability. Unfortunately, in this case, the rent was small and localized, and we managed it with the viscoelastics and controlled antechamber pressure. These two factors played a significant and critical role in preventing extension of the tear, where we were able to safely implant the toric IOL in the bag with the good centration and stability. Please pay close attention to the video, especially to how we handled the pressure gradients and how we manage them in the polar, especially in the polar cataract surgery. Avoiding sudden decompression of antechamber is key, and any abrupt change in the pressure can lead to devastating postcapsular rupture. So enjoy the video, observe the key steps, and take notes to the precautionary measures that helped us achieve a successful outcome in this particularly potentially risky situation. And if you have any comments, please notify in the comments box. Thanks and enjoy the video.